Hello, I'm Dr. Jerry Jones, and I teach advanced electrocardiography throughout the United States and around the world. I'm based in Houston, Texas. I want to tell you about my new book that will be released this fall, Getting Acquainted with Wide Complex Tachycardias, a workbook for the electrocardiographically confused. I see a lot of books on sites like Amazon or Barnes& Noble, or even on YouTube, that proclaim ECGs are made easy, or made simple, or made unbelievably easy. Well, that's fine if you're just beginning to learn the very basics of ECG interpretation. But none of that is really difficult. I do take exception when some of these sources start to get into the more complex issues, like ischemia, infarctions, blocks, and especially wide complex tachycardias. Nothing that you learned as easy, simple, or unbelievably easy is going to help you there without extra training at the intermediate to advanced level. As a physician who practiced internal medicine and emergency medicine for almost 40 years, and who spent the last 12 years exclusively teaching advanced electrocardiography, I can assure you that you aren't going to learn all you need to know about interpreting ECGs in a few hours or even a few weeks. Sorry if I burst your bubble, but those are the cold hard facts. Now, my book is for those with at least an intermediate level of ECG interpretation skill. So what do I consider intermediate? If you understand and are comfortable with the ECG section of the ACLS protocols, then you should do just fine. Let me give you an example of what I'm talking about. This is a scar-related monomorphic ventricular tachycardia, and the type that you'll see in many textbooks as an example. It's relatively easy to look at the QRS complexes here and identify their morphology. An RS complex in lead 1, a QS complex in lead 2, for instance. Now, let's take a look at the wide complex tachycardia that you would likely face at 3 a.m. in the emergency room or some critical care unit. Can you identify the QRS complexes now, quickly and confidently? Do any of these leads make sense to you? Here are a few pages from the book. As you can see, not only is there text explaining the different phenomena, but exercises to reinforce your new knowledge and skill. Now, remember that this book was written by someone who once stood exactly where you're standing now for almost 40 years. I know your strengths and weaknesses because I experienced all that myself. I was never an academic physician who spent most of my time in an administrative office. My book will teach you to identify the ventricle in which the wide complex tachycardia is originating, the area of the ventricle, the outflow tract or the apex, where the ectopic focus is located, if the ectopic focus is on or near the septum or one of the free walls, if the tachycardia is one of the benign ventricular tachycardias, and if the patient is in immediate danger. And you will do all that in less than 30 seconds, probably much less than 30 seconds. My book is a workbook. It's not an academic reference text. Now, the academic reference texts are very important because they teach what causes these tachydysrhythmias and how to treat them. But what they don't teach you is how to identify what's there in front of you. I recognized this a long time ago and began teaching these skills in my master class in advanced electrocardiography and master class in advanced dysrhythmias. Now I'm extending some of this same training to you. Thanks for your time and attention. I hope to see you in one of my classes, either here in Houston or somewhere around the world. Until then, expand your skill with Getting Acquainted with Wide Complex Tachycardias, a workbook for the electrocardiographically confused.